There's certainly a lot of stressors that go along with having a health condition such as CKD. So things like physical discomfort and pain, interrupted sleep, all of those things that are happening in the body. There can also be side effects from medications, frequent medical appointments that require people to miss work and school. So all of those are certainly stressors that can contribute to mental health challenges. There are also some direct impacts of the illness and treatment itself. So things like uremia, as toxins build up in the blood, there can be an impact on the brain. So, attention, concentration, mood can all be particular challenges. There can also be other things that go along with CKD, like anemia, for example. So when people have low iron, they might feel more fatigued. There might be a bit of an impact on their mood. So all of those things put people at an increased risk for having some challenges with their mental health. With young children, these things can show up a little bit differently. So, when we think about sort of going through the stages of development, the closer to adult they are, the more similar something like depression would look. So for a teenager, it might be quite similar to an adult. For younger children, though, they oftentimes show stress through body symptoms. So we might see changes in their eating, we might see changes in their sleeping, those types of things. There might be some complaints of body pains or discomfort, and that can be a way of the young person expressing that something's the matter, but they don't have the vocabulary yet to be able to say, I'm feeling sad or I'm feeling low. So we can see more of those body complaints. So I think it's important to think about sort of going back to the basics. So things like healthy eating, prioritizing enough time for sleep, getting exercise is a really critical piece, managing stress, reducing stress whenever possible, calling in your support system, seeing if there are some things in the course of your week that you could, give up for a period of time, doing things like yoga or meditation, whatever you do in your life to manage stress, anything that gives you relaxation. It can also be really helpful to connect with other people. So making sure that you reach out to your friends, your family, your support system. I think, if those struggles like a low mood or anxiety go on for quite a period of time and it is getting in the way of day-to-day life, then it is time to think about asking for help and support. So for adults, a really important person to start with would be your family doctor. Also your kidney care clinic team. When it comes to crisis services, it's also really important to know that those exist 24/7. So, in your local area, there will be crisis services and crisis lines that can click in if someone really needs in-the-moment support. So for children, again, family doctors are a great source of information, or a pediatrician, and that's a really great starting place. For adults, the Anxiety Canada website is a really great source of information. And actually, both for adults and for children, they have resources that are really across the age span. The Canadian Mental Health Association website is another really great source of information. And then the other one specifically for children and youth is the Kelty Mental Health website. They have an amazing website. They also archive things like expert presentations, webcasts, things like that. And so that's another really great source of information around mental health broadly in young people.